Good afternoon and welcome to Our World, Our Power radio show. Today, we are going to be discussing health care issues and we'll be talking with one of our great healthcare providers. Just letting you know, speaking with Lady Pauline, your host, and your co host, Mr. Glenn Greenwich, the Honorable Mayor of Southern Boulevard. Paul Bartley is our guest today. Welcome to Our World, Hour of Power show.
Welcome, Paul.
Thank you. Thank you for having me.
You're welcome.
Paul, I've known you many, many years.
Yes, yes.
And matter of fact, I was your instructor.
Yes, you was.
And I'm very proud of you. I wanted to let you know I'm very proud of your progress that you have done in your career. Can you list some of your credentials?
Sure. I'm a credentialed alcohol and substance abuse counselor. I also have an international certification as an alcohol and drug counselor. I am a certified recovery coach. I am a certified recovery peer advocate. I am a certified recovery coach, trainer of trainers, which means that I can teach a course, a class to teach other people how to become certified recovery coaches. I also have a mental health first aid certification, and I am a certified case manager.
Wow.
Okay. Wow. What aren't you yet?
Doctor.
Okay. All right. Well, let's get this conversation started. We're going to be talking about how has the coronavirus affected your clientele?
Wow, that's a very good question. As with everybody else, it has affected, it's a pandemic, so it's affected everybody across the country, across the world at this point. Specifically with the population of people that I deal with, let's start off with the substance abusers. It is very difficult for them as well as the providers because the social distancing. So being that clients cannot walk directly into their outpatient programs like they used to and be able to sit down and have one-on-one counseling sessions with their counselors or participate in the group setting, and I mean the intimacy. I know now and all over, a lot of agencies are doing the virtual or the telephone, the telecommunicating, which is great. Don't get me wrong, which is great. But I know that to be able to actually meet with the client in person, see them, talk to them, read body language, things of that nature, also helps a whole lot. Talking over the phone is great. The Zoom is great. But, the intimacy of being able to sit down and conduct a one-on-one with the person right in front of you. And even though they may say one thing, the body language might say something else, which would then prep you to ask a different question to possibly help them with something that they are struggling with. So yes, the coronavirus has definitely put I'll say a little slight damper on the way things are done now.
Yes. Paul, also I would like to find out how do you see the changes that's going to be made? I know next week a lot of stuff is opening up. I don't know if one of your agencies is going to be opening up, or what are some of the protocols that is going to have to be made? What's some of the protocols that's going to have to be changed in order to survive in the new world that we're in today?
Yeah, the what we call the new norm.
The new norm, yes.
Yeah, the new norm. Well, some things that I've heard and I've been part of the discussion with are putting up these things like barriers, plastic barriers. And please keep in mind that when you go to a lot of your local bodegas, supermarkets, places of that nature, they have them in place already in order for them to continue to run their businesses while the coronavirus is still present.
Correct.
So that is kind of sort of the same type of plastic guarding, I want to say, that will now be used across the desk and also to separate yourself from even other staff members, because we are very aware of the people who are asymptomatic. meaning that they aren't showing any signs and symptoms of the actual coronavirus at this time. However, if they took a test, they would probably be positive. So
Okay.
even though you're not showing any symptoms and you're positive, you still have the opportunity to spread it to somebody else, whether it be a coworker, whether it be a client, whether it be a family member. So yeah, the plastic barriers is something that I believe that we were looking into to see how would that work. You know, how much separation would that really be? Because majority of the places already have the mandate in place to wear face masks.
Mhm.
So that's going to be part of the new norm, you know, face masks. And I still see a lot of people wearing gloves, you know, the
Right.
plastic gloves as well. So this plastic barrier is supposed to be something that would be able to, you know, keep if the person is asymptomatic or actually, you know, showing, exhibiting signs of the coronavirus, not only would you be able to counsel them and explain to them that it might be a good time to go to the emergency room or go seek some, you know, help from your primary care physician, but you will not be exposed to it because the plastic barrier is supposed to, you know, keep it at bay.
Okay.
Question
Yeah.
for Paul. What level of stress do you think that the virus itself, and then having to put on a mask and gloves to go out and interact with the world, what level of stress is it having for people who are dealing with mental handicaps and or abuse, you know, drug abuse? You know, how much stress are we talking about?
We're talking about very high levels of stress, especially in the beginning part when it first hit and people were not aware. Then once the awareness came about, and you know, of course, with the media, whether it be, you know, TV or social media, once it was made, the masses were made aware that this virus was actually here before we actually knew it was here and already spreading. People's anxiety levels went up. People started having panic attacks. More people became depressed because having to be forced to stay in place, shelter in place for long periods of time, in some cases, depending on the mental health condition that you have, can be very stressful. And on top of that, you know, some people have mental health conditions that they aren't able to just stay in one place for long periods of time, meaning weeks and weeks and weeks without going outside, without getting fresh air, without moving around. And of course, we know with the social distancing, that's also difficult too. Because let me give you an example. Let's say, for instance, you're running a CR, you know, a residential program, congregate care program, and you have people who are sharing an apartment. If one person becomes positive and isn't aware, the likelihood of the other person becoming positive is, you know, very easy to happen.
Yes.
And then on top of that, if it is inside of one building, all it takes is one positive person, and before you know it, you have 5, 6 people positive. And then if any are asymptomatic, they are spreading it unconsciously, and then here we go. You know, the whole building will at some point have it. So, you know, I'm glad that they finally came out with the testing for it, you know, and I believe that, you know, whether you feel sick or you have some symptoms of the coronavirus or anything different is going on with you, you should definitely get tested.
Yeah,
It's better
I've,
to know than not know.
I'm definitely going to go out and get tested myself. Let me ask you this question. Given the fact that the coronavirus has now identified a problem that has been historically in our community, Black and Brown community, have not had the same access to health care that other groups of people have had. What do you see in terms of the heightened awareness and what can be put in place to now begin to circumvent or at least address the issue?
Another very good question. What I have noticed is that it seems like once the Department of Health was able to actually uh, come up with those numbers, calculate those numbers, and determine the amount of people And the hotspots, that was the main thing, the hotspots. Once they were able to determine exactly where the hotspots were, it seems as though they have now put in place more testing centers. You know, I've been tested twice. One time I went on my own. I had a number, 888 number. I called, I set it up, and I drove directly to the place. Never made any contact with anybody. And then finally, once I got to the end, is when they took my information with all my windows up. They took my information. You know, you take your ID card, you put in the window. They write down all your information, your address, where you live, your phone number, how to contact you, whether you are a essential worker, frontline worker, police officer, fire, you know, whatever your status is. And then at the very end is when they will, you know, they tell you to roll down your window, and then they have, of course, the swab, and they will swab you, and then they would give you a website that you can go to and check in 48 hours to get your results. So everybody being tested, especially in the hotspots. They have identified four hotspots. I can only think of two at the moment, and one is in the Bronx, and I can't think of the zip code, and another one is in Queens, and I can't think of the
That's in Elmhurst.
Okay,
Yeah.
excellent. So those particular.
There's one in Elmhurst, there's one in Far Rockaway, and there's one at college.
Okay, all right. So yeah, so there's going to be, starting Monday, there's going to be those two testing centers that I know are opening up where you can walk in, because of course not everybody drives. So you can just walk in and get tested, which is great, So once they were able to identify these hotspots, they now put testing centers there. I believe that the numbers, and this is my personal belief, that the numbers are going to go up because of the asymptomatic people. The people who are walking around like me, you, you know, Miss Swift, and we feel fine and we look fine and we don't have any symptoms or anything. But then when the test comes back, it says that you're positive. So that means to me, at some point in time, you was exposed to it and may not even have known.
Okay.
So yeah, so these hotspots that were located, and the fact that testing centers are either open there already or are going to open, I believe is going to be a great thing. It's going to help the community, because majority of these centers are being opened within the Black and brown community, because exactly like you said, for some reason we seem to get the worst health care, the worst everything.
Well, you know, something that's interesting is that when you look back at the Job Act, the Health Care Act came right shortly thereafter, because what they realized is that they couldn't send people to work who were sick. So they created the Health Care Act to be able to support people getting jobs and being able to keep the jobs because of their well-being, which are both over 50 years old, by the way. So that conversation has been around for over 50 years, but not till this coronavirus did we actually get aware of the numbers specifically. And then, of course, you had the Elmhurst, which was overrun, which went that it's largely an immigrant population, you know, not a whole lot of communication, living, you know, multiple families in one apartment, what have you. That all is you know, and maybe not even having money to buy the gloves and the mask and all that as well. So all of that contributes negatively to being able to get access to the healthcare. So I'm glad that that it's been highlighted. I would now want to see what's going to, you know, what policies are going to be put in place to address those needs. It's nice that they're doing the testing in our community, but that's a short-term conversation. What's the long-term conversation for equality in the healthcare industry?
You know, something I wanted to say to you, Paul, is that I don't understand is I know the press that keeps saying that it has affected you know, brown and black community and poor people because they don't have any medical coverage. But from my memory of working in the healthcare facilities, um, a lot of people that had substance abuse issues or mental health issues did have medical coverage. So it wasn't, as far as I was concerned, a fact that you couldn't go to the doctor because you didn't have medical coverage. You may not have went to the doctor because you just didn't want to go to the doctor.
Right, right. Well, I mean, for the most part, yes. Majority of the people have who have substance abuse disorders and mental health conditions. Majority of them, yes, they do. You know, the ones that are able to, they do have some sort of insurance. But now let's also, you know, that brings up the discussion of the ones who are unemployed, do not have a mental health condition, and do not have a substance abuse disorder. They are without insurance. And then you also have the ones that have insurance, but the co-pays is so high due to the insurance carrier, the HMOs, because they play a big factor as well.
That's true.
So yeah, so the HMOs, they only cover this, they don't cover that, you know, or the co-pays is so high, and depending on what type of job that you have, you know, what type of employer, you know, signed on with what HMO, that plays a big factor too. Because if every time I need to go to my outpatient program, methadone program, see my therapist or my psychiatrist, and I have to pay a $20, $30, $40 copay, and I'm seeing them, you know, if I'm doing substance abuse outpatient program, I'm going maybe 3 times a week. So
That's true.
let's just go at $20 each time. That's $60 a week. 120 for 2 weeks, and we know the rest of the math. Now, if I have a job that I work, I don't know, in a grocery store, or I work for an agency, and my rent is due, will I take that 240 and pay for my services, or would I put that money towards my rent? You see what I'm
Okay.
saying? So now they have to make decisions. You
Right.
know, my food is running low. I need to put food on the table for my family. What do I do? Do I miss a couple of days out of the outpatient program? You understand what I'm saying?
Hmm.
So if I'm not employed at all and I'm looking for employment, because we know the numbers, 6.3 million right now, because of the coronavirus, and a lot of that was even before, it's very difficult for a person to make that decision on what to actually do, which bill to pay, don't pay. I pay half on this one, half on that one. In the long run, it winds up catching up to you. So it's a little bit more than just the people who have mental health and substance abuse. I know that's the topic of today, but it's just a little bit more for people who do not have any of those disorders, but are struggling to make it from day to day.
That's very true. I agree with you, Paul. Now, something that we all know, I know you touched on it a little bit, being a therapist, counselor, um, we deal with that one-on-one basis, that intimacy, you know. Um, how do you think it's going to sort of affect the clients when they see the barriers up? Is that might be a deterrence to come in, to even though they may understand why the barriers are up, but sometimes people have phobias. Ordinarily they don't want to be like, locked into, a barrier, and how do you think, the you're going to deal with it? I should say
Well,
the different agencies.
right. Well, it's going to be difficult. It's going to be difficult on both levels. It's going to be slightly difficult for the therapist, the case manager, the counselor. Or the caseworker. It's going to be difficult because now they have to operate in a different capacity. But it's going to be also difficult for the client as well, because this is what going to be part of the new norm, and they're going to have to figure out, are they still able to make that connection? Is the counselor still able to make that rapport with the client? Now, if you had that rapport before, it's going to be slightly easier because you already know each other. You kind of know, one another. But for brand new clients coming in, it's going to be a little hard. It's going to be, it's going to be something that is going to have to be worked on a constant basis. Of course, things is going to be tweaked. Things are going to be, discussed. I'm quite sure that there's going to be a lot of morning rounds where staff members are going to bring to the table their cares and concerns to the upper management, And of course, things are going to give one way or another until it totally becomes the new norm. In the very beginning, just like once I was sent home and told that you're going to work from home now, was that a shock for me? Definitely. Definitely. I'm not used to sitting at home working from my couch. You understand? So yeah,
Yeah.
it was a big difference,
Uh-huh.
than getting up every morning, going into the office. Yeah, reaching out to the clients more, talking with staff more Zoom meetings, all of that was definitely kind of like a culture shock. But just like with everything else, you have to adapt.
Correct.
So it's also going to be a slight, change when you have to now readapt to going back into the office 5 days a week, and then, like I said, seeing these barriers and, everybody walking around with masks. And, some people are still very nervous and afraid because just because things are opening back up and the economy is going to, people are start going back to work and things of that nature, the actual virus has not gone anywhere.
No.
It's still present. You just now have to figure out, you have to use all these precautions to avoid contracting it, but it's still there,
Okay.
and until they can actually come up with a cure for it, this new norm is going to be around for a while.
Wow.
Yeah,
I
I
know
don't see things ever going back to the way they were,
before.
pre-coronavirus. Yeah, I don't ever see it going back to so freely like that again.
Yeah.
Let me ask you a question around, because all businesses are being affected by it, cash flow wise, the social distances, you can't have as many people. What impact is that going to have to your industry, the health provider industry?
Well, it has already had a great impact. I believe that again, in order to run a group setting with 10 or 15 people, now it's going to basically be, extinct. We're not going to be able to do that. I believe you might be able to have 5 to 7 people, and of course, 6 feet to 12 feet away from each other. Again, still required to wear the mask. So it's going to make things just a little bit different, a little bit harder to hear. Because I've noticed that when I talk to people in person, they have a tendency, not everybody, but a lot of people have a tendency to want to pull the mask down because their voice cannot be projected through the mask and they don't feel like they're making that connection, whether it's hearing or for you to see their face to understand and get a better picture of what they're trying to convey.
True.
Yeah, I see that a lot. I see that even if I stop at a light and I see 2 people talking, I see that a lot. In some cases, I've seen where both people have pulled down their mask just to have a conversation. And of course, there's so many different type of masks. The thinner ones, maybe not so bad, but when you have the other ones that seem to be a little bit thicker and that have the padding inside, which will not allow the virus to get in, but at the same token, it doesn't really allow your voice, to get out that much as well because it covers your whole face. I've said that people will pull it down and have the conversation and then put it back up. And it's almost like that's defeating the purpose.
Correct. That makes sense.
Yes.
It's so funny you're mentioning that. I was watching Home Shopping Network last night, and they had on they had these hats, the baseball caps,
Mm-hmm.
and they have a shield that covers your face, right?
Uh-huh.
And you also can attach your phone to the hat, and also
Oh,
have on the mask at the same time. And I'm saying, my goodness gracious me. I mean, what type of communication, what type of relationship are you going to have with people, when, because I remember running groups and sometimes clients would come in with their sunglasses on. And I would tell them, please remove your sunglasses because they were hiding behind the shade, so
right.
you weren't
You,
able to see, if they were high or how they felt.
yeah, you need to see the eyes to see if their pupils is dilated. Yeah,
Yeah, yeah. So I was laughing because I know, our clients are very, how can I put it?
manipulative at
Very,
times.
yes, that's the word. Yeah.
Yeah,
Uh-huh.
yeah. And like I said, because of the situation that's going on, and not having the frequency of seeing your client on a regular basis, other things will happen. They will take this opportunity because if a person is not strong in their sobriety, this is the opportunity now for them to say, wow, I can get high because I'm not going into the office, and who's going to take my urine to know?
That's true. I didn't even think about that. That's very true,
Yeah.
Paul.
So if I'm not really going into the office as much as I was going in before, and I'm not getting that urine taken twice a week randomly, so I don't really know what day or what time or when they're going to call me in to say, hey, come here, I need some urine for a toxicology screening, then that gives them the opportunity. You know, I had a client who claimed that he was going to the outpatient program on a regular basis, and unfortunately, he wound up overdosing and passing away. So we know that this opportunity here for people who aren't really like grounded in their sobriety is going to be a difficult time because they see so many ways that they can possibly use without having any consequences or repercussions behind it.
Okay.
You
What
know?
happens to, I know you used to do
Excuse me.
home visits. I know as a case manager, you used to go and to, check on your clients. And with that checking on your clients and you're going to their house, you were able to see, a lot of different things that might be troubling. And, like sometimes I used to open up a cabinet in the kitchen and, realize that they didn't have any food,
Right,
you know.
right.
So, or just different living conditions you're able to visualize, you're able to see when you go to somebody's house, how their children look,
Definitely.
yeah, how does the wife look, how does the husband look, and so forth and so forth. And I'm just trying to figure out how that's going to work because you're still dealing with at the present time the distance as far as the 6 feet,
Yeah.
and some people are not even opening their doors. They and they're having food delivered, but the person just drops the food and then they
Go.
leave, and then boom.
Yeah,
you
yeah.
know
Well, a lot of agencies, what they have in place is, of course, they're not doing home visits as much as they were doing it in the past. They definitely have slowed that down because of the concern from the actual case manager.
okay.
Like for instance, I have a few friends and they are outreach workers. So what they do is they outreach the homeless, train stations, hallways, abandoned buildings, rooftops, basements, things of that nature. At one point in time, a lot of them were getting sick with the coronavirus because they were not really aware at that time that the coronavirus was spreading as rapidly as it was. So even after they had contracted, they were still going to work because they had no idea that they even had it. And then slowly but surely, sick, can't come to work, hospitalized, things of that nature. So that, I believe, sent a nice warning to the whole social service field itself, to where they, at one point, slowed down to almost stop doing home visits unless it was an emergency situation. In an emergency situation, you basically had no choice but to do the home visit. But of course, you wore your gloves, you had your mask, you did the social distancing, you had the hand sanitizer. You prepared yourself to do the home visit. Also, I know that a lot of agencies, they also go around and give masks and gloves to the clients. Go
Yes.
to their house and give it to them because they know that it's difficult for people just to stay home. So since I already know, and you already said that you're going to go out, because some things you got to go out for. If you got medications that you need to get at the pharmacy, a lot of them stop delivering because of the same thing. And you can't really drop at the front door or put things down at the front door when it is like certain medications. You
Right.
know, any ones that are high value on the street. Oxycontin, Vicodin, Percocet, and we know that we have people who take them legitimately for the legitimate issues that they
Yes.
were designed for.
Hmm.
But the controlled substances, we know that if you order something from Amazon, a pair of sneakers from Amazon, and they put it in front of your door, and by the time they call you and say, hey, I just put it in front of your door, by the time you open the door, it's gone. What do you think is going to happen to your Vicodin?
It's going to be definitely gone.
Yeah, yes, any type of opiate that's gone. Nobody's going to wait around to see if you're going to come and get it. As soon as he put it down and he turned his back, somebody picked it up.
Right.
So so going around giving out the mask and the gloves for people that have to go to the pharmacy. And as you probably seen, the pharmacy lines is very long.
Yes, they
And
are.
some people are social distancing, and for some other people, I don't know if it just doesn't make sense to them, or they just, not really aware of the news and what's going on, but they're still standing very close to each other.
Yes, that's true. They are. That is correct. I have been out occasionally, and I do see, that people are, not
Moving
distancing.
around like normal.
Yeah, and then of course what's happening with the protesting, the rioting that's going on, you have a mass amount of people that's together, so there's no social distancing,
at all. So so giving the gloves and the mask to the actual clients is a one precaution, and then whenever they run out, of course, they would call you and say, hey, listen, I need, or do you happen to have any more? Because when you're dealing with singles, let's say for instance, and you have a person that lives in a 1-bedroom apartment, then you can give him 5 masks and he knows that those 5 masks are good for at least 1 week.
Oh yeah, okay.
Even the local pharmacies, they selling masks, but they selling 1 mask for $2. Now remember the people that we're dealing with here, these aren't people who have abundance of money. So spending $2 a day to buy masks is going to take some food off my table. I'm not going to be able to pay something or get something that I need. So a lot of agencies were just giving the mask away to the clients. Now, if you have a family of 4, a husband and his wife, and then they have 2 children, then even the children need to wear masks. I've seen that a lot on the street as well. The mother and father have on masks and the children don't.
Yeah.
And so what they do is they give enough masks for every member of the household. When the masks start to run down low, you call, and if there's more masks available, then they provide more masks. Every attempt is made by the social service agencies in order to try to stop the spread of the virus. But remember, you can only do your part. So if you wear the mask, that's great. And I always tell all of my clients, wear the mask. And they say, but I don't have it. Okay, you don't have it, but somebody who you may come in contact with may have it. So you are protecting yourself. And if you're asymptomatic, you might not even know that you have it. So wearing the mask will keep from spreading it to somebody else. Because, and just going back on the protesting that's going on, I am a firm believer that at some point in time, the numbers are going to start to rise again. I pray that it doesn't reach nowhere where it was at in the middle of March or April, but I think that the numbers are going to rise again because you have upwards of 500, and I've seen one time it looked like it might have been 1,500 people protesting, but at least half of them, no masks, no gloves.
Yeah.
And what I also noticed too is, now, it's the difference between the protesters and the rioters.
Right.
The protesters and the looters. What I've seen, the looters and the rioters have on the mask more frequently than the protesters. Now, we know the reason why.
Yeah, because they don't want to be identified, right?
I want to conceal my face because I don't want people to see, because you know how the world is set up now. There's a camera everywhere.
Yeah, true.
If you walk down the street, a person can follow you for 10 blocks just on different cameras.
Yeah.
So they are definitely wearing the mask. And again, it might not be for the right reason, but at least it is protecting them.
Let me take a moment here and pay some bills here.
We'll be right back. But first, are you a small business owner looking for solutions? TMI and Partners is a business solution company offering operational, branding, and financial solution. For only $9.99 a month, your company will be assigned a personal business advisor. Well, that's right, only $9.99 per month, no contract, and you're on your way. Call TMI at 347-234-5304. That's 347-234-5304. Or visit their website at tmium.com. Tomorrow, the world will know your business. Is that it, guys? Hello? Did I do good?
The collaborative experience was created on the philosophy that together everyone achieves more. Founded by Julia D. Shaw and Tony Coleman Brown, together they have over 40 years of combined book industry and marketing know-how. This allows aspiring writers the opportunity to become published authors. Already, they've created over 4 Amazon bestsellers, including the Delayed But Not Denied series, and also their latest project, which was Our Stories, Our Voices, Black Men Speak Their Truth, which also debuted as a hot new release on Amazon's bestsellers list. Let this dynamic duo guide you through the writing process and provide you with the support and education in publishing, social media marketing, and PR to help create a winning literary experience. Learn more at www.thecollaborativeexperience.com.
Hi, this is attorney Stephen G. James. We've been practicing law at this law firm for over 30 years. I'm a former assistant prosecutor in Kings County and currently a defense attorney to serve you better. We work harder to serve you better. So just call us for the lawyers you can trust. 646-905-9000. 646-905-7001. We're located on Sutphin Boulevard, right near Hillside here in Jamaica, Queens, New York. For over 30 years serving the community. The law firm of Stephen G. James. Thank you.
I also want to take the time to say you're listening to Our World, Our Power, and you can hear us on Spotify, iTunes, Google Play, TuneIn, CBT TV and radio, Roku, Apple TV. Did I leave anything out?
J102.
Oh, yeah, okay, J122. That's EAJ 102.3 radio. And don't forget to follow us on our website, which is ourworldmedia.com. And our email is ourworldmedia. And social media, Instagram, Our World Media, Facebook.com, Our World Media. And if that doesn't work, you can always call me at 646-340-7271. Glenn, how can people reach you?
They can always reach me at 718-291-2110. That's Sutphin Boulevard Business Improvement District.
Okay, let's continue this conversation. The one part that we didn't bring up is domestic violence.
Oh, yeah.
Yeah, I really want to talk about that because when I was working in the field, I ran a lot of domestic violence groups. And we all know that when there's conflict in the home, the one thing is to escape, you know, like whether you couldn't wait for your partner to go to work. Or if it's the kids, you know, well, at least I'm going to school and I'm getting away from my parents or my guardians. So there was always that escape gap. Tell me, because I know you're in the field, what has been some of the numbers that you have seen change with the domestic violence? I know it's gone up.
Yes, it has gone up. I wouldn't say a great deal, but then again, I'm not, the one crunching the numbers. What I will say though is, let's start off with the school kids. The kids are in school from, let's say 9 to 5, 9 to 3:30. So that gives them quite a few hours away from their abuser.
Right.
While they are in school, they have the opportunity to be seen by school teachers, guidance counselors, and most schools now have a social worker there who plays the role of a therapist, well, who is the actual therapist. So there are several professionals that are there within the school to be able to observe the child to see if there's any signs of abuse, neglect, things of that nature. With the schools being closed, that opportunity is gone completely. Now, I have a few friends that work in the Department of Education. What some guidance counselors, social workers, even principals are going out to some of the kids' houses to provide them with food, because a lot of the schools are giving away food to the needy. That gives them the opportunity also to see the child. They have the online learning where you have to do a certain amount of exercises online. They even provide you the computer. If you don't have Wi-Fi, they provide you the Wi-Fi box. These are other ways that are used in order to monitor the children. Now, and it's working. It's working very well, because if you give the student, and they have to be online 4 or 5 hours out of the day to complete this project, do this project, complete this project, not only do you get to see the participation of the parent, because if the kid is 5 years old, the child is going to need some help from the parent to complete these different projects, build this, do this, go to this website, learn this. When we get on the Zoom together, we're going to go over this, that, and the third. So now you get to see some of the participation from the parents. That also gives them the opportunity to see, okay, is the mother or father, are they abused? Do they have a black eye? Do they have excessive makeup on? Do they, all the things that are usually done when a person wants to conceal the abuse that's coming from within their household.
Correct.
And the same thing that you said also, if it's the mother and the father that's going through the domestic violence situation, when he goes to work at 8 o'clock in the morning, she feels at ease because, again, I got at least 8 hours before he's going to come back home. Now that he's not leaving to go to work, or she, because we know men get abused as well, it's not reported as much, but yes, it does happen. Whether he or she now is not going to work, that means that I don't even have those 8 hours of peace that allow me to be able to put everything in place and prepare it by the time he or she comes home, because I don't want to be hit. I don't want to be yelled at. I don't want to be screamed at. I don't want none of that. So at least my child is in school and he is at work or she is at work. I can clean the house. I can cook the food. I can wash the clothes. I can do all the things that's needed. So by the time he or she returns, there's really nothing, unless they had a bad day at work, for them to get on me about. That opportunity now is gone, because now they're home 24 hours a day, 7 days a week.
Yeah.
So a lot of the domestic violence hotlines have been called a little more. Well, in some cases, a lot more, because they need help. They need to figure out, well, how do I stop this from happening? And in some cases, this has pushed them to the brink to even make them want to make the phone call. Because before, they kind of felt like, I can manage it, I can deal with it. Now it's like, okay, now I'm getting it 24 hours a day, 7 days a week. I can't do nothing right. I can't this, I can't that. I can't take it no more.
Right.
You see? So yes, the numbers have gone up. Again, I don't crunch those numbers, but
I know you don't.
Yeah, they have gone up. But I like what they put in place for at least the kids, because for the kids to be home with their abuser more now because of the virus, of course, is going to be more traumatic for the child. Going to need therapy, going to need counseling, going to need a whole bunch of things in order to even try and understand why these things happen to me. So yes.
And the tablets and the computers at least gives them a line to the outside world so that they can say they need help.
Yes, or at least allow the professional to see that they need
help. Right.
Even if the child doesn't verbalize it, even if the mother doesn't actually say it, or the father doesn't wave a red flag like, hey, somebody come here, at least the professional would be able to identify something's going on there. Let's conduct a home visit, or let's send a CPS worker or the ACS worker, or let's go deliver food and like you said, let's observe and see if they got food, if she's being abused, if she's hiding in the bathroom when we come, when normally she's the type that would meet and engage us. All of these things are signs and symptoms that something may be going on.
Right. I agree.
A question for you, because, as I listen, I'm listening to Department of Education, social services, health professionals in general. Are we working towards having technology, computers and iPads and tablets and such available in every household? Because the more and more we are isolating ourselves, or at least trying to protect ourselves from going out into this coronavirus world, it sounds like there's a sort of populational need for the underserved to actually have technology and some other kinds of tools to be able to get their needs met, be it healthcare, education, training, working from home, all of those kinds of things. What are your thoughts about that?
Well, I definitely believe that let's go with the Board of Education. Just the fact that they were able to provide the school kids with laptops was a great thing. Now, I'm not sure if every single one of them got it, because if you have your own device, and we know how school kids are nowadays, they got the cell phones, they know better than me and you about Zoom and Skype and, all of the social media platforms. They know it better than me and you put together. But yes, the ones who had it already, they gave them access to be able to log on to do schoolwork. The ones who didn't have it, they provided them with actual laptops, some iPads. And then the ones who didn't have the Wi-Fi within the house in order to, activate the actual iPad, they provided them with the Wi-Fi boxes that you can use to log on. So I want to say that within New York City, at least, I know for sure that they are working hard and have done a good job so far with making sure that kids still have access to their schoolwork. Now, I have a family that live in Jamaica, West Indies. They are going through a lot there because, of course, it's completely different. The government there seems to try to model the way the United States is doing it as far as providing them with it, but they don't have the funds to be able to provide all of the kids with these particular items that's needed. So if a mother has a Wi-Fi or if a father has a cell phone and it has the features on it, then of course they ask them to use it that way. But to do 4 hours worth of, work on my cell phone and I need it, to use up all the gigabytes on the Wi-Fi, it's very difficult. It's not as easy as it is in New York. It's slightly different because here in New York, once the Wi-Fi box runs out, you call them and let them know, and they have a way to reload it again, and then now you have another 50 gigabytes.
Okay.
You see what I'm saying? So now you are able to continue and use the Wi-Fi for the purpose. As we know, I think it's June 28th, school is going to be officially out.
Right.
So then, that's not too long from now. So I'm not sure exactly how they do it, but are they going to continue to allow them to use the Wi-Fi for their own personal needs at that time? Because with no school, basically you're just going to have to hold on to the laptop. Now, also keep in mind, in a lot of these households, they didn't have a laptop or iPad before this situation happened.
True.
And then the other ones didn't even have Wi-Fi before this situation happened.
Yep.
You understand? So with the pandemic still in place, and I know we're opening up slowly. Upstate has opened up. They're in phase 2 right now. Monday, we're going to be in phase 1. But I'm not exactly sure. Do they allow them to continue to use this? I've also heard, some professionals say school is going to start back in September. I also heard some other professionals say school isn't going to start back in September because they're not going to have enough time to put in whatever contingency plan, because how do you have 5-year-old children social distance from each other for long periods of time?
It's not going to work. They can't sit still for 2 or 3 minutes.
Exactly.
More to tell them to sit here and
exactly.
Yeah.
So that's why I believe that they're probably going to need more time to figure out how this is going to work, because the classrooms are going to have to be downsized for sure. You can't have 20 kids, 30 kids, and the teacher and the aide. That's not going to work. It's not going to work. And then we already know about this so-called mystery virus that the kids are contracting that has to do with the corona. So it's symptoms from the coronavirus, but they can't say, it doesn't have a specific name or way that all of these kids are contracting it. So what they're calling it is a mystery virus. Maybe by now they do have a name for it, but yeah, a lot of kids are contracting that, and some have passed away, some have recovered. So you also have to keep that in mind when it's time for school to start back as well. Because if these kids aren't in school and they're contracting it, what's going to happen when school starts?
Yeah, and then they're going to spread it back home, bring it back home to their mother, their grandmother, and so forth and so forth.
Exactly.
So it just keeps on.
Yeah, me personally, I believe that a lot of parents know that their kids want to play with other kids because that's their age range. They want to interact. So when I let my kid go next door, because it's right across the hall, right next door to the other kid over there, and then that parent over there lets her kid go right down the hall to the other kid over there, before you know it, half the building now have this mystery virus.
True. True.
So
Yeah.
it's still working.
Paul, it has been a pleasure talking with you. I hope our listeners have gotten some good information. Our time is up, and I just would like to say thank you again for coming on our Power. Please don't forget to follow us on Instagram and Facebook. And if you need to call me, 646-340-7271. Thank you, Glenn.
Paul, I just wanted to say again, thank you. Thank you for being a professional in our community and serving us. I really appreciate that you have all those certifications so that you can then go out and serve our community. So thank you for doing that. Continue to be safe and blessed. And if there's anything that you need to publicize or need to, to say to the public, please come back and use our show as a vehicle for that. Because what the work that you're doing is very, very important. Thank you.
Thank you. Thank you for having me. I appreciate it. One thing I do want to say, if there's anybody who is in need of substance abuse services, you can always contact Oasis. You can definitely go online, Oasis, oasas.nyc.gov. And if you have a mental health condition or you're not sure if you do, or you just would like to speak to a counselor about it, you can always contact a NAMI, N-A-M-I.
Great. Thank you, Paul.
Thank you,
All right.
Paul.
Thank you for having me.
All right. Catch
Okay.
you all next week. Take care and have a blessed week.
Have a blessed week.